Hello, Rick Ricciardi. Thank you so much for joining us today and to honor NAPNAP on its 50th anniversary.
Wow, 50. I'm just so pleased to be with you and to be going to the meeting. I'm excited to be going to the 50th anniversary celebration meeting.
Isn't that amazing? Well, for those of you that are watching, Rick Ricciardi was president of NAPNAP from 2004 and 2005. And we're really looking forward to hearing about some of your experiences during your presidency, Rick.
Well, thank you. I look forward to sharing them, and hopefully we'll help others to do great things, just like we did as a team back in 2004, 2005, and I know that you all are doing today.
Excellent. Well, to get us started, Rick, I'm wondering if you might be able to share with us what made you decide to become a pediatric nurse practitioner?
Well, that's a great question. And I think prior to getting to becoming a pediatric nurse practitioner, perhaps it would be even more interesting if I told you how I became a nurse. Because as Dr. Ford says, got to keep the nurse a nurse practitioner. So I actually was an undergraduate and studying to be a math major, and I graduated with a math degree in applied mathematics. And then I wanted to be a high school teacher, and I couldn't find a job because at the time there was some challenges in hiring teachers. So my sister, who's 2 years younger than me, was saying, oh, I'm going to become a nurse. Why don't you think about becoming a nurse? I'm like, nurse? Let me check this out. So I went and I looked at the New York Times. We grew up in New York City. And I said, wow, there's jobs galore for nursing. I'm not making that same mistake again where I'm going to get a degree and I'm not going to be able to find a job. So I was like, tell me about nursing. Well, we like to teach. We like to be involved with people. Teaching, that's what I wanted to do. And that was like one of the first words that came out of her mouth. I was like, okay. I looked at it. I found out there was lots of jobs. And so my sister and I, we started nursing school together. So we were in the same class. I applied in the same program she was going to so that we could go to school together. So that was just an exciting journey. Became a nurse, and then I decided I wanted to serve my country because my family immigrated from Italy, and this country through Ellis Island with the statue in New York. We saw it every day. They were just embracing all the immigrants as we came in, and my family had a great life here. So I had this strong desire to give back to our country. So I joined the military. And little did I know that I would make the military career, because when I started, I said, okay, I'll do 3 to 4 years and then come back out. And, but it just worked for me. So while I was in the military, I had some opportunities. And one of the opportunities was to go to nurse practitioner school. And I was doing pediatrics because of my love of children and adolescents and families at a very, through nursing school. I knew that was kind of an area that I really, really felt passionate about. So the military had a certificate program in Fitzsimmons Army Medical Center, which doesn't exist anymore. It was in Aurora, Colorado. And it was affiliated with the University of Colorado, which was the school that started the NP role back when Loder Ford and Henry K. Silver. So that was my foray into the PNP, because the military had provided me with that opportunity to go for advanced training. And I decided that I also loved, in addition to loving nursing and to loving pediatric nursing, I also had a very strong affinity for the military and the warfighter community and helping to, build strong families.
Rick, that's incredible. So from applied math degree to teacher to nurse, and you found your way to becoming a PNP. I have to tell you, my husband also has an applied math degree, so you two will definitely get along. All right. So now we followed you through your PNP education journey. I'm wondering if you can share with us now, how did you find your way to the NAPNAP presidency?
Whoa, that was a long road. This didn't happen right away. Well, I started getting more interested in policy, what the NP could do on a public health level, and be impactful in our communities, while actually I was a PNP student and had the opportunity to be mentored by Henry K. Silver at the University of Colorado. Now, I learned a lot from Henry. First of all, he was not your typical pediatrician in his day. He was very much interested in going beyond the clinic or going beyond the hospital in the acute care setting or the ambulatory care setting, and making a difference at a population level. And for him, it was the state of Colorado in the beginning. He was very much interested, and that's where I had a lot of influence, because Henry was very much involved in trying to shape policies within the state of Colorado that was improving access to healthcare for children and families, most particularly in underserved and underrepresented areas of the state. So him and I had discussions about that, and I realized that by joining a professional organization, and for me the logical choice was NAPNAP, is that I could get more involved at a grander scale, rather than just my military clinic where I'm seeing patients, which I loved without question. And it really, it was nirvana for me to do that. But I also wanted to get more engaged with national policy. So that was sort of my foray into joining NAPNAP, getting involved with NAPNAP first at the chapter level and working with the chapters, learning more about the great organization, and most importantly is meeting the people, within the organization that provide you with just this abundance of knowledge, support that was totally different from the military. I had my military side, which was, very different from the private sector and, nonprofit side like NAPNAP. So I really enjoyed the blend of being a federal, and being a service member and be part of the federal government, but also having an opportunity to see different thinking, different groups, and shaping policy around children and families.
Well, that's incredible. First and foremost, I want to say thank you for your service, Rick.
Oh, my pleasure. Thank you for that.
And second of all, hearing your story and having heard some of those of others, I'm struck by the similarity there. It's this love of that pediatric encounter, but also that drive to expand your influence on the profession and child health. And really that sort of catalyzed your movement into leadership within NAPNAP. So that's wonderful. I'm wondering, Rick, since we were talking about advocacy and policy, is there a particular issue that you recall being of the utmost importance to the PNP profession or NAPNAP during your presidency?
There was lots of them, just like there are lots of them today. And some of them are the same. For example, health equity and access to care. We've talked about access to care since the beginning of the NP role, and we're still talking about access to care. We did then talk about full practice authority, and which is still an issue now in many states, although we didn't call it full practice authority back then. But the other things that were sort of unique that were of very much interest was the reshaping and the boom of the nurse practitioner role from mid-90s to late 90s and into, where I was, where there was a genuine feel, Jennifer, there was a genuine fear that the pediatric NP role might go away because of the huge numbers of family nurse practitioners that were graduating, and that the academic programs tend to focus on the family nurse practitioner. And we were starting to feel the pressure of that, at the point when I was on the board, in looking at our membership numbers, looking at where the future of the profession lies, and looking at who's really caring for children and families in primary care. Because Jennifer, as you remember, a lot of these NP positions started in ambulatory settings before the big boom went to the acute care settings. So we also were transfiguring and transforming our thinking around, okay, we got to get up to snuff on this, acute care stuff. We really need to be focusing on acute care, because that perhaps is the future of the PNP role, because there's very specialized acute care activities that a family nurse practitioner is just not well suited for. And so we kind of had to blend that with what was happening in the day, the challenges that we still have today, and look at some of the newer initiatives that were happening in the external environment. And two of the big initiatives were, this may sound a little odd now because it's so prevalent, but the idea that overweight and obesity was a problem. And one of the big initiatives that when I was on the board and when I became president was convincing the world that pediatric overweight and obesity was actually a problem. Now, I know it's hard for you to believe now, but people just didn't see obesity as a disease. They didn't see pediatric obesity and adolescent obesity as a problem at all. They weren't putting two and two together. And we were, as an organization, were very much trying to be behind that science and pushing that and trying to get more interest by policymakers, by funders of research, by journalists, by the media, for it to become more of an issue. And some of the problems that we still have today, we tried to address relative through this our work at NAPNAP around child and adolescent mental illness, which so there was two big initiatives that were happening while I was on the board and when I became president. One was the Healthy Eating and Activity Together, which was called the HEAT Initiative, which was, at the time, we were so far ahead of the curve. And one of my biggest disappointments was, as president, is that we couldn't get it picked up by, big funders to really help our Healthy Eating and Activities Together, or the HEAT Initiative, to get enough external funding to really build the guideline and implement the guideline, which was evidence-based, to a higher degree than it actually became. So we were doing the early work really on one, which was to make the world aware of the problems associated with pediatric and adolescent overweight and obesity. Two, what can we do from an evidence-based perspective to implement strategies and interventions that can impact or reduce or mitigate child overweight and obesity? And that was multiple iterations, but probably the most influential person in that was Mary Margaret Gottesman, because she was two presidents before me. It was Mary Margaret Gottesman and then Dr. Brady and then me. And then at the same time when I was president, I was working with Bern Melnick on the what was called the KISS implementation. Was keep your child safe, secure and safe, and that evolved into the behavioral mental health work that we currently continue to do at NAPNAP with the different guides. So we had the HEAT initiative and the KISS initiative going on two very important topics. One was obesity, and two was child and adolescent and mental health.
Rick, this is staggering. I mean, first and foremost, that your mentor was Dr. Henry K. Silver. And like you just recalled for us like some really seminal moments in our profession. So not only being mentored by Henry, of course, but now talking about, you know, the emergence of the acute care role and some of these really pressing issues that today are still at top of mind. So, I mean, this is just, again, I'm staggered. And what's really gratifying to see is that early work that you and Bernadette and others have done, I mean, we're continuing to build on that today. So we have our NAP Cares initiative, which is this really bold all of NAP initiative aimed at pediatric mental and behavioral health. And it's really building on that foundation that you all built. So I'm just, thank you for what you've done.
You're welcome. This work, unfortunately, won't end. You know, it's a continuous process. And, you know, if we just have to take it on, I mean, that's what we have to do. That's what we do. And we have to be tireless, and we have to be, you know, just ruthless in some ways and gritty in making sure that families and children are getting their slice of the pie in this healthcare system that often pediatrics is like, you know, rounding up the end. You know, or the scraps, if you will. I hate to use that term, but many times we feel like, you know, the pediatric community is getting the scraps, what's left in our big healthcare pie. And that's just not acceptable. It's just totally not acceptable.
Agreed. Well, I am going to shift gears slightly and ask you now, Rick, what sort of challenges did you and your fellow board members have to deal with at the time? So I'm thinking more internally as a board. Were there any events or issues that stick out to you?
Well, I think the biggest event was we were concerned that perhaps the organization was going to go away with the increasing numbers of family nurse practitioners and their ability to care for children in ambulatory care settings, and the way that academics was focusing on the FNP role and not resourcing the PNP role, with the exception of the faculty who were NAPNAP members who were fighting for, you know, resources to continue that the PNP. So really, I think one of the big decisions that we had to make was to refocus the organization to really see, I know you're going to find this hard to believe, but acute care pediatric nurses as equal partners to the primary care. And in fact, team, that we were really partners in this journey of providing efficient and effective care to children and families. That was not the thinking back then. You know, it was not. I know it would be hard for many new people or people today to realize where in many ways the acute care PNP has become, you know, one of the major players within NAPNAP. So examples of that is that we as an organization had to make sure that we, on committees, on all the work we did, we wanted to intentionally have a broad number of primary care NPs, PNPs, and acute care PNPs, so that as we move forward as an organization, that there can be equal representation from both groups. To include the journal, where we had the journal editor-in-chief, because I was on the search committee for the previous editor-in-chief. We selected, you know, the editor-in-chief to be a primary focus, and the co-editor to be an acute care focus. That was intentional, but at the time, now you would look back on that and say, "Oh, okay," but really that was intentional because, as an organization, we had to really step up our game and supporting the acute care and PNP role.
That's fascinating and really visionary on the part of the board to anticipate, okay, this is where we need to go as an organization, and really to bolster the viability of our profession as pediatric NPs. So that's fascinating. I'm wondering, Rick, we've touched on this a little, but I am going to ask, was there a particular healthcare topic or innovation that was driving your advocacy efforts and or policy efforts during your time as president?
Well, as you know, our strategy was on overweight and obesity and pediatric mental health. So NAPNAP doesn't have the resources to cover all the ground. So we had to really prioritize our advocacy focus. And it was, I would say, for my presidency, a lot of it was on overweight and obesity because it was just not being seen as a healthcare problem. It was just, dealing with policymakers at the state and federal level to try to open their eyes to understand the health risks, both short and long term, relative to overweight and obesity in pediatric populations. So we just went full court press on that. And of course, the second one was on policies relative to behavioral mental health issues. And both are equally important, but at the time, given the environment and that there's a lot to be said about looking at policy development, what's happening, out in the field, and what's of interest to the policymakers. What's most salient when you're looking for the most salient opportunity. And we really pushed on the obesity and the overweight and obesity to try to, with the CDC, with HHS, with funding opportunities through NINR and other groups to really try to, break ground in that area.
Well, thank you for that. And obviously that is a very big issue that's quite salient even today. So it's lovely to hear that we were really at the ground level, elevating that as a priority.
We really were. I think we developed the first evidence-based clinical practice guideline on pediatric overweight and obesity. And that guideline, which was very unique for a guideline, thanks to the great work of Karen Duderstadt, had a health policy component to it, which was very unique. If you look at clinical practice guidelines, they rarely, if ever, have a advocacy component to the guideline. So we really were at the cutting edge.
Well, I'm noticing a recurrent theme here: vision, cutting edge, pushing the envelope. That's amazing. Well, I'm wondering, Rick, if there's a particularly memorable experience during your NAPNAP presidency that you would like to share.
There's lots of them, but I think during the presidency, I was really, really struck by the commitment of the board of directors to really achieving the mission of NAPNAP. And the degree of collegiality, the degree of just connecting with like-minded and very smart people allowed us to move forward a very complex agenda to move forward. So the other piece that was happening operationally is that we came up on our contract for our office, which we had in Cherry Hill for a very long time. So we had to move the office to a new office. And so we were in the search of looking for the new office, which was the office until they moved to New York in downtown Manhattan. So that was also another interesting experience of working with the CEO and the board to find a place for NAPNAP to rest its head on for the next decade or so until we moved to New York. But I think the most thing that I remember most are the relationships. I could name, a bunch of names, but then I might forget somebody, so I don't really want to do it, of people who have influenced me in such a high degree that I would not be the person nor the nurse that I am today if it wasn't for them.
I think you captured that beautifully, and I can certainly attest that that's been my experience as well. I mean, it's this intense working relationship and collaboration with people I had never met before, and yet these are people that will be part of my life forevermore. It's just such an amazing and special experience, and it sounds like it was for you as well.
Yeah, no, it really was. It's unforgettable, and it's something that I would always cherish. Not only my time as president, though, but my time on the board, because it really is sort of, to me, it's similar to just like one experience, moving from treasurer for 4 years to president, was my 4 years as treasurer on the board, and then my time as president is just very, very special.
I agree. Transformational for me as a leader, although I wasn't treasurer, I was secretary. But Rick, all right. In looking back on NAPNAP's first 50 years, and what an amazing 50 years it has been, what is something that you are especially proud of?
Well, the first thing I'm proud of is my to be associated with such great colleagues like you, Jennifer, and all the other NAPNAP members who are so dedicated and just really tirelessly working on behalf of children and families, both at the street level, practice level, front lines of clinical care, teaching the future NPs and nurses, advocating for policies at the state and federal level, and even at the organizational, the small p level, to really improve care, despite tremendous odds, of just working and fighting and crawling up that hill. And for NAPNAP to be the infrastructure, the organization that provides the tool for all of the human capital, for all of the people to work toward a common goal. I also very proud of NAPNAP in its ability, and this is one of the advantages to be a smaller organization, in its nimbleness, its ability to have situational awareness of what's happening, in the world around us and in healthcare, and to, take the risks to go out on a limb to really, fight for what emerging issues in child and adolescent health. And I believe NAPNAP has done that, despite the challenges of fighting against organized medicine, which are huge. I mean, organized medicine is a formidable force that, often acts as a barrier for different communities to really work the kind of work that can be done. But despite, many barriers, NAPNAP just uses its resources very wisely. It's not huge in size, but it's huge in impact.
I agree. And it is challenging to prioritize and pick those one or two issues that we're going to champion so we can do it really well. And you're so right. It is a challenge, but we are impactful. We are effective. So, Rick, looking at your very accomplished career and all of the impact you've had on our profession and by profession, I mean pediatric NPs and nursing as a whole, I'm wondering if you could offer some advice for our emerging and future NAPNAP leaders.
Well, I can try. There's from my career, I think the best advice I can give is that you maintain a sense of serendipity in all that you do. And what I mean by that is when the door opens around you, you have to have the sense of awareness that a door is opening. And two, you have to have the sense of courage and just passion to go through the door. So there's many paths that life takes us through. Be aware of what those paths are. Don't shut yourself out just because you've just finished your PNP program and you think you know what you want to do. Be the best at what you can do where you're at, but don't limit your eyes and your ears to what's open around you, to move to different positions and try new things and be curious. I think a sense of curiosity is critically important to drive innovation and to drive passion. So try to maintain a state of curiosity. I've always said that complacency is the ruination of nursing. And if you feel like you're getting complacent, then do something about it. Once you recognize that what brought you joy or what got you out of bed every day is no longer getting you out of bed and is no longer bringing you joy, it's within your power to do something about that, because maintaining a sense of openness and serendipity to all the different positions and jobs and opportunities that nurses have across the spectrum, whether it's professional organizations, whether it's clinical practice, whether it's academics, whether it's with private industry, whether it's starting your own business and being an entrepreneur, and doing, or whether it's becoming a scientist and conducting research and developing patents or, whatever. These are all open. Once you find yourself not having passion for what you do, you don't have to get out of nursing. Just find that position as a nurse that is going to reconnect you to your passion or your joy or what is going to get you out of bed every day.
I love that. Maintain a sense of serendipity. Oh, that is spectacular. I would often say make the leap, but yours is far more eloquent. But you're so right. Nursing affords us so many opportunities that there's always a new challenge around the corner. And so thank you for that. I'm wondering now if we can look inward for you, Rick, and if you could go back in time to share some wisdom with your younger self, what might that be?
I would say listen more and talk less. Question more and reflect. I just repeat that. Listen more and talk less. Question more, have a sense of curiosity, and reflect. I wish I was better at that when I was a younger person.
Very wise. Well, I'm going to go off script here because I know that you were personal friends with Henry K. Silver and are with Loretta Ford. I'm curious if you can speculate. First off, what would Henry think of Nap Nap today?
I believe that Henry would be astonished, just like Lee is, about the growth of the nurse practitioner role. I think that the size and how much it has influenced the delivery of healthcare in the U.S. I don't believe that was in their first vision, and could the expectations have gone far beyond what I think that they had anticipated. I think Henry would be very proud that his idea that the science of healthcare, the health assessment, the prescribing of medications, the differential diagnoses was being conducted to the degree that he knew nurses could do it. Henry was convinced right from the beginning that nurses would make great clinicians. That was radical. That was radical. And he fought a huge uphill battle with his medical colleagues on that, which he was willing to do. Why? Because he saw the value in his North Star, which was the families, the children, and the adolescents who were not receiving care. And he knew, because we talked about this, that the physician community would not be providing that care because he tried to get them to do it. And, they didn't want to go into these remote areas or in areas where the capacity to make large sums of money, let's get down to the business of healthcare, was not as sustainable as it was in other places. And the quality of life, if you like to live in big city versus living in rural America, there's a difference there. So, or underserved areas of America. So Henry would be very proud of you, Jennifer, of all of the NPs, because they are carrying out his vision of providing care in a high quality way, which he knew we could do as nurses, and which we all know we can do today. But back, in 1960s and 1970s, that was not the case. And, he wouldn't be patting himself on the back. He would be saying, you all deserve a lot of credit for what you've done. And that he would just be so thankful that there's been an increase in access, based on his vision and what he knew we all could do.
That's amazing. And so I'll now turn it to Loretta Ford. I know you've spoken with her recently about NAPNAP's major milestone and how the PNP profession and larger NP profession has progressed. So what are some key takeaways that you had in your recent conversation with her?
Well, Dr. Ford, let me just preface this by, there is no one like Dr. Ford. Even at 102, she still is on the cutting edge of thinking and the cutting edge of being bold. Dr. Ford would be the total description of what the word be bold means. She has been bold from day one, and she is determined. So, I would say that Dr. Ford is also someone who is very proud of the accomplishments of the NP. But one thing I would tell you that Dr. Ford would not put a lot of weight into that, because she's a forward thinker, and she would say, I don't care. I mean, I'm very happy and I'm pleased with what we have done in the past. She would say, I'm more interested in what we can do in the future. She is a forward thinker, always looking for ways to change, transform practice to make it better and to demonstrate the value of nursing. And not just the nurse practitioner, but as you know, because Dr. Ford always says, you can't take nurse out of nurse practitioner. And she means it when she says that, because she's a public health nurse and she understands the value of what nurses can do across a wide swath of determinants of health. Not just delivery of care in the clinic, but what can they do outside of that care in a clinic or an acute care setting in a hospital. And I think that's where she would be driving the determinants of health. How can we still, as nurses, impact both from health policy, but also from a perspective of care delivery, the determinants of health to improve the health and well-being of, our families, our children, our adolescents, and our adults for that matter. Because you really, whether it's at the end of life in the elderly population and caring for people with dementia and people who want to age in place and, and have that kind of community, it's the same across the continuum in terms of everyone wants to have, access to quality and affordable healthcare.
Thank you for that insight into the founders of our profession. And I will be so bold as to say, Rick, I can definitely see their influence on you. And I am certain that they too are proud of all that you have accomplished. So thank you to your service, to NAPNAP and our profession. It's really immeasurable.
Oh, thank you. And it takes a team.
Yeah. Yes, indeed, it does. Well, thank you for taking the time to meet with us today. This is truly a historical archive of some of NAPNAP's wonderful history. So we appreciate you taking the time.
Of course, my pleasure. Be well. And I know NAPNAP's first 50 was excellent. I just can't wait to see what the next 50 looks like.